Here we will discuss some of the drugs where we give some specific names to the drugs, like we already discussed about orphan drugs. So drugs which are used for rare diseases mainly. So basically the sale of the drug is not expected to meet the expenditure made on that drug. So these are called orphan drugs. We discussed that separately. Apart from orphan drugs, there are some drugs known as essential drugs. Essential drugs. So as the name tells, essential, necessary. Essential drugs are the drugs which cater to priority health care needs of a population. Priority health care needs of a population. Now there are two important things in essential drugs. One is population, second is priority healthcare needs. So for essential drugs, first of all, we need to define a population. For which population we are talking about. The population may be as large as a country, like essential medicines of India. Okay? But the population may be as small as a family, like essential drugs for my family. Okay? So we need to first define a population. Then in that population, we will write the diseases, incidence and prevalence wise. Like I can take the example, suppose in my family, a person is there with hypertension. So antihypertensive drugs become essential for my family. In another person's family, there is a person with the diabetes. So anti-diabetic drug become essential for them. So anti-hypertensive is not essential for that family and anti-diabetic is not essential for my family. So essential drugs may differ depending upon the population we choose. So what we do, we make a list of incidence prevalence wise the main health issues in that population. So the drugs used for those, they are called as essential drugs. So priority healthcare needs of a population should be met. Now essential drugs, they should always be available in that population, should always be available. They should be available in adequate quantity. Adequate quantity. And with assured quality. So three important things should always be available in adequate quantity with assured quality. Like we can take the example, suppose in a primary health care center, commonly daily around 30 to 40 children of diarrhea come. So that means ORS become essential. So what we do, we give 10 packets of ORS in that PHC. So obviously it is illogical because already 40 patients are coming and every patient will require 2 or 3 packets of ORS. So we need to give in adequate quantity. Otherwise there is no point if giving the drug, because we need to cater to all the population. And third thing, obviously the quality we should be assured that it will work. So these three are there. Plus most of the essential drug we try to make as single compounds. Usually we do not use the combinations in essential drugs. They're mostly single compounds. So that is important about the essential drugs. Then there is a type of drug named as Me Too drugs. Me Too drugs. As the name says, that drug is saying I am also present. Me too, me too, me too. Okay. So what is the meaning of Me Too drugs? So the drugs which usually end with similar names, like all the prils, enalapril, ramipril, captopril, lisinopril. So all AC inhibitors. Similarly, all sartans, all ARBs, all LOLs, all beta blockers. So they are considered Me Too drugs. So Me Too drugs means these drugs have same mechanism of action with almost similar uses. So that means their pharmacodynamics is more or less same. but they have minor pharmacokinetic differences. So minor pharmacokinetic differences are there, like some is long acting, some is short acting, some has bigger volume of distribution, some has lower volume of distribution. So when they have minor pharmacokinetic differences but more or less same mechanism of action and same clinical uses, these are called me too drugs. Clear? Then we have some drugs which are defined under Drugs and Cosmetic Acts, like spurious drugs, misbranded drugs, and contaminated drugs. Spurious drug means here there is a well-known pharmaceutical company like Cipla. Cipla is making a drug, and most of the people, doctors, they trust Cipla. So they are making a drug with some particular brand name. Now a new pharmaceutical company has come which has just established few months back. Now this company keep the name of its drug similar to Cipla. Okay? So the new company is wanting to take the advantage of popularity of a well-known company. So such drugs are called as spurious drugs. Okay? Then misbranded, as the name says, if there is any misinformation on the label. So anything on the label, if it is wrong, it is called misbranded drug. Like the drug is Schedule H. That means it should be given by prescription only, but it is not mentioned. So it becomes misbranded. The drug contains tablet contains 200 milligram, but on the label it contains 500 milligram. It is a misbranded. So anything wrong which is given on drug label is called misbranded drug. And third is contaminated. The name tells, if the drug contains some unhygienic or filthy material in it, it is called contaminated. Very commonly they give a picture in which there is a tablet and one hair is coming out from within the tablet. Clear? So this type of a drug is contaminated. Clear? So these are the differently named type of drugs. Clear?